I figured. Okay. All right. Great. So where were we? We were talking about yeah,
Yeah,
cartigenars,
you know,
cystic
and
fibrosis, right?
cystic fibrosis.
All right. All right. All right.
Yeah.
So then, what in regards to the presentation? You already discussed the misfolding of the protein, but in regards to the presentation, right? What makes one different from the other one, other than the heart is off to the right for cartigenars? What else?
Mhm.
What else is affecting them? Talk to me more about the
Uh,
infertility.
Yeah, in cystic fibrosis, I think the problem is that they lack seminiferous tubules.
Very nice. Yeah.
And in Cartagen, the problem is they have it, but it doesn't works properly because of the DNA defect. There
Very
is
good.
lack of mobility.
Exactly.
Yeah,
And because of that, the cilia is gone, and not just
yeah,
cilia, but we also have remember the fallopian tubes contain
yeah. The
like our
fin, yeah,
cilia-like, right?
yeah,
The fimbriae.
the fin.
So therefore, that's why the woman would become infertile, and that's again why the guy would become infertile as well.
Yeah.
See that? All right. Let me see what else can was going. Oh, so with cilia, it in and of itself, that's why the patient. Well, what is cilia going to do in the lungs? How about that?
Yeah, is
What does it help
well,
with?
it helps fight infections. Like one of the primary mechanisms.
How though? How? What is cilia really doing?
Mm,
Remember, it's beating, right? And it's
okay,
pushing mucus up and up
mix.
and up, right? Moco. That's what he does. It
Yeah,
pushes mucus, and normally, hopefully, the mucus uh, it binds up everything that comes in, or all this dust and stuff. That's why I
yeah,
just sneezed, right? That something came in, so it tries to get rid of all this stuff in the form of mucus, and then the mucus you will eventually, um, what is this? Swallow, drink it every day.
okay.
Yeah. So that being said, if we don't have any cilia, then well, we're gonna have a lot of mucus accumulating inside the lungs, causing a restrictive or an obstructive like lung disease.
Uh, restrictive
Ooh, restrictive is trouble getting air in. These are patients who have a lot of mucus, trouble getting air out.
yeah,
Remember,
yeah, yeah,
obstructive
yeah,
lung
yeah, yeah,
disease is
yeah,
obstructive.
yeah,
Yeah.
yeah, 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 yeah,
All right. Very nice.
yeah,
Very nice. Very
yeah.
nice. Okay, that's enough of that one. Blue sclera, osteogenesis imperfecta, type 1 collagen. So we already spoke about collagen earlier. Remember the skin and bone, tendons,
Yeah,
ligaments.
yeah,
Osteogenesis imperfecta, what is it? How does it present? How does he present?
um, the patient will have the repetitive fractures of the bones with
Patient has,
minimal
yep,
activity.
yep.
Mhm.
They like to compare and contrast this to abuse, child abuse.
Yeah, yeah.
So what
And
are
you
some
always
things?
have,
Go ahead.
yeah, you always have to check for that. You have to see if the veneers say that the patient has different um, stage of healing.
The wounds have different stages of healing.
Yeah,
Okay.
yeah,
There's
mm,
unique shapes to the wounds, like they'll say circular shaped wounds.
yeah, yeah. Like for
Why?
instance,
Why circular?
cigarette smoke.
Cigarette burns. That's messed up, right?
Yeah,
Cigarette burns. Okay. What else? The stories don't match up.
yeah.
Mama says the baby rolled off the bed. Huh? The baby
Mhm.
rolled off the bed, and the baby's like what? A month and a half, 6 weeks old. You're like, babies don't
Yeah,
roll at that
no,
age, so it just doesn't add up. You see? So
yeah,
now, if that's not the case, and they have very brittle bones, right? Then clearly there'll be osteogenesis imperfecta. Um, let me see, what else did they mention about that? Oh, pleiotropy is a big term they like to use with osteogenesis imperfecta. Pleiotropy. What does that mean to you? Pleiotropy.
pleiotropy.
hmm
Mm.
I think of it as like
The like the blue discoloration.
No, 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 no.
No.
No, no, that's just the presentation. Pleiotropy is a genetic term. It represents, I think of it as an avalanche. You know, the avalanche, the snowball effect, I think is how they call it, the snowball effect.
Yeah.
One little
Yeah.
thing, one little, you know, a squirrel drops something, a nut, and then that causes
Mm.
something to shake, and then eventually, boom, crazy. You know, very
Yeah.
similar to
Okay.
that. A small little mess up, a small hiccup
Hmm.
can cause devastating complications. That's osteogenesis imperfecta, i.e., look at the
Yeah.
presentation. It looked pretty bad.
Yeah.
Yeah. All right. All right. Nice. Elastic skin, hypermobile joints, a lot of bleeding. That's Ehlers-Danlos, type 3 and or type 5 collagen.
5.
Okay.
Mm. Yeah.
Ehlers-Danlos, to talk about the hypermobile joints, bleeding tendencies, but this is a collagen vascular defect, right? So we're going to have
Yes.
other areas. Whenever I have a collagen disease, what I want you to think of scab, skin, collagen, arteries, basal membrane. They can all be
Yeah.
affected, doctora, all of them. So here they
Oh,
say elastic skin. You say, yeah, duh, elastic skin, right? Because
okay.
skin. They say
Yes.
hypermobile joints. Of course, hypermobile joints, skin and tendons, ligaments.
Tendons. Yeah.
Yeah. They say increased bleeding. Duh, of course, increased bleeding. Why? Because arteries, basal membranes. You see?
Yeah.
Makes sense. And they also get mitral valve prolapse. They tend to get mitral valve prolapse. If I'm also not mistaken, they also get they can get aortic dissection, kind of similar to Marfan's. It's just that Marfan is more common for that. Okay.
Okay.
All right. Very nice. That was Ehlers-Danlos. All right. Well, look at that. Since we're talking about Marfan's, again,
More.
same thing. Collagen vascular disease. Say collagen, so scab. So then they talk about the retina. Okay, dislocation. Why? From the basement membrane.
Basal. Okay.
Oh, okay, basement membrane. Of course, yeah. Type 4 collagen, right?
Okay.
Also
Yeah.
they have what else do they mention here? The mitral valve prolapse. What else did they mention? Uh,
Uh,
the aortic dissection, because something is
reflect.
known as, okay. Anashka has, she's upset
Yeah.
about the Marfans. Yeah, I get it. So we have the aortic dissection. Why? Because of something known as cystic medial necrosis,
Yeah. Cystic medial necrosis.
in which you have necrosis of the media,
Oh, medial.
right? And you have cyst formation. See?
Okay. Yeah.
Cystic medial necrosis. All right, nice. And then, of course, hyperflexible joints. Of course, all this, duh, because we're talking about collagen. This is pretty straightforward. All right. Excuse me. McCune-Albright, cafe au lait, precocious puberty, and polyasthenic.
Multiple.
So bone issues, precocious puberty, and bone issues, and cafe au lait spots. So this is what I want you to remember first.
Okay.
When normally you think of cafe au lait spots, what disease do you think of?
I'm thinking about Fanconi,
Yep,
neurofibromatosis type
exactly.
1, and Albright
And now,
syndrome.
this one,
Yeah.
exactly. Always those three. Muy bien. And how to differentiate those? So they say cafe au lait spots, and she has a lot to say.
Yeah.
So how do I differentiate McCune-Albright from Fanconi's, from neurofibromatosis? They all have cafe au lait spots.
Yeah, maybe if they say that the patient had hyperthyroidism or
I mean, I need much more than that, doc.
yeah, like the
In cafe au lait spots
yeah
and with neurofibromatosis, what do I see in
the
neurofibromatosis?
neurofibromatosis you had the lesions on the eye.
Sure, leash nodules,
Yeah, nodal. Yeah.
mental retardation or
What?
intellectual
Yeah.
disability,
Yeah.
right? What else?
The neurofibromas.
The neurofibromas. You see
Hmm.
that? Okay, good. That's very visual. What about Fanconi's anemia? Small fat thumb, short
Yeah.
kid normally, bleeding diseases, just bleeding.
Bleeding.
You see anemia, you're like, okay. And then
Yes.
McCune Albright, precocious puberty, bone disease, and cafe au lait spots. See that?
Yeah.
All right, nice. Now, give me 1 second. Let me.
Just staying up.
What's the other version of Duchenne? The one when he's a little bit older, let's say 5, a little older than 5.
Yeah. The Becker muscular dystrophy.
Becker's, right? Okay. What's a frame shift mutation? I'm gonna say a frame shift mutation is a dystrophy. What does that mean?
That will be a deletion or insertion.
How many?
A number that it cannot be divided by 3.
So yeah, when you insert or delete one or two bases, insert or delete one.
Yeah.
Right. Very
Okay.
good. That's frame shift mutation. All right. Let's see. What's the next one that they talk about? Okay. Infant with a cleft palate, cleft lip, microcephaly, holoprosencephaly, polydactyly, Culis aplasia, all the P's.
Yeah.
All the P's.
Yeah.
Pals, right? The lip.
Yeah.
Palate. The
Yeah.
polydactyly, aplasia, pals. What's another one? Puberty. Right? What else?
Okay.
Anything else? Trisomy 13. What's the cause of that?
Can you repeat that?
What's the cause of the trisomy?
Non-disjunction.
Non-disjunction.
Yeah.
From mom or from dad?
From mother.
Very good. Very good. All right. The difference between Edwards, or what I want you to know about Edwards, other than trisomy 18, is make sure you get that clenched fist. Kind of looks like this. You see,
Okay.
like this finger, the index, wrapped across. All right, so that'll be my clenched fist.
Okay.
Very important to know. He has rocker bottom feet. So does Patals, but you just need to make sure that Edwards is. Well, again, they'll give you the clenched fist. Okay, Patals is very specific. He's very unique in his presentation. Downs, they say the single palmar crease. So, well, we'll get to Downs in a second. Let's just keep it moving. Dilated cardiomyopathy with edema, alcoholism. So the wet beriberi. Talk to me a little bit about thiamine. Why wet beriberi? What's the connection between wet beriberi and thiamine disorder or this deficiency?
The connections.
Yeah, what's the connection between thiamine and a patient with wet beriberi? Why does B1 cause wet beriberi? What is wet beriberi?
Well, yeah, the patient get dilated cardiomyopathy.
Why?
Edema.
Why?
Because because the anemia.
I'm listening. All right, doc. Enzymes.
Okay, right.
No, let's do this. Let's do this. What enzymes are deficient with thiamine deficiency? What enzymes are deficient? You must know this.
Yeah, like 4 enzymes. Like
You wanna know?
Yeah. I know those enzymes, but I can't remember the name right now.
So phosphofructokinase. Glucokinase.
Alpha keto alpha.
Okay, nice. Alpha ketoglutarate.
Alpha, yeah.
Transketolase.
The transketolase.
Pyruvate dehydrogenase. What else? Branch chain dehydrogenase. Okay. The
Okay.
amino acid?
Okay.
All right, good. So what is this berry? What's the issue with this? Well, they have neuropathy, just neuropathy. That's dry berry. When it's wet is when you have cardiomyopathy.
Yep.
What's the issue here? What's trying to be necessary for? Again, pyruvate dehydrogenase. I'm trying to get glucose, put them into the mitochondria, and create ATP. That's what I'm trying to do, right? But if I can't get them into the mitochondria, then what happens to the glucose? This pyruvate just kind of like accumulates, right? I think of it like this, like sugar just accumulating inside of a cell. If I have a lot of sugar accumulating inside of a cell, then what's going to happen? What gets pulled into that? Water.
Okay.
Edema, cardiomyopathy.
Okay.
Nice. All right. Let's see here. Let's see. What else we got? Dementia, diarrhea, and dermatitis, pellagra, niacin deficiency. All right. So who gets pellagra? What's like a classic, what's this word I'm looking for? A classic scenario. Who gets pellagra?
A patient with a corn diet.
Yeah, no, corn-based
Yeah.
diet, right?
Yeah.
Corn-based diet, tea and toast diet, Coca-Cola hot dogs, Coca-Cola pizza diet, those things. Okay, B3 deficiency. Very good. Okay, now niacin, it has a precursor amino acid. What precursor is this? What's the precursor amino acid to niacin?
Niacin, tryptophan.
Tryptophan. Nice. So then that means that if I lose tryptophan, am I going to have niacin?
No.
So if I lose tryptophan, I can have pellagra?
Yeah.
Interesting. What disease is that? Losing tryptophan.
Carcinoid? No.
Given, yeah, well, technically speaking, yes, carcinoid syndrome can potentially lead to a niacin deficiency due to the excessive use or overuse of tryptophan, or converting it rather into serotonin. Any idea? You guys got it. Heart nups.
Yeah.
Very important to remember. I'm going to mention the guy that looks, smells, and tastes like pellagra, but they have amino acid difference. So once they start mentioning amino acids in the urine, you're like, okay, this definitely has to be Hartnupp's disease. Okay.
Okay.
Very nice. Swollen gums, mucosal bleeding, poor wound healing, petechia, scurvy, right? So it says here you can't hydroxylate proline and lysine for what synthesis? Collagen. See that? And what was our scab?
What?
Are you there? Are you hearing me? Can you hear me?
Yeah. Now.
Okay. I was asking. Okay. We have issues with hydroxylation of proline and lysine.
Hydroxylation. Yeah, that's
exactly vitamin C deficiency. So what does that mean? I have no collagen. We already spoke about collagen.
Yeah.
That's a mnemonic. Scab.
Scab.
S, C, A, and B. Scab. Skin.
Scabs.
Ligaments and bone. Right. That's S for skin.
Yeah.
And tendons and bones. C is for connective tissue. A is for arteries. And B is for basement membranes. Scab.
Yeah.
Okay, good. So what that means is that if I have vitamin C deficiency, any one of those can be affected. Skin can be affected, tendons, ligaments, sure. Causing swelling of the gums, yeah. Poor wound healing, why not?
Yeah.
Bleeding, petechia, yeah. Skin, bone, tendons, ligaments. Connective tissue, arteries, basement membrane. See that?
Okay.
Very nice. But you need to remember that it's going to hydroxylate proline to hydroxyproline and hydroxylysine. Very important to remember that. Okay, they like to ask that. Also with that, make sure you know the steps of collagen synthesis.
Collagen synthesis.
Yeah. From the rough endoplasmic reticulum to the Golgi to the tropocollagen to the once it gets released and the whole slicing and dicing, right, via the proteases. Please make sure you know that those steps. They will ask that. Okay.
Okay.
On that. Oh, everyone. That means focus. All right. Good. So what else do we have? So Corey's versus von Gerks. It's very important. Corey's versus von Gerks. What's the issue with von Gerks, Doc? What enzyme is deficient?
Mm,
Says it right there.
is the core, yeah, the branching enzyme deficiency
Glucose-6-phosphate deficiency.
in
Von Gerks.
Bonjerk, yeah.
Glucose-6-phosphate deficiency or phosphatase.
Just,
What does glucose-6-phosphatase do? What does it do? Glucose-6-phosphatase. Anyone know? Glucose-6-phosphatase. What does it do?
yeah,
Says it in the name.
yeah, with glucose conversion.
So it's going to ACE the phosphate group
Mm.
on glucose, on the 6 carbon. It's going to ACE the phosphate group. So it's going to convert glucose-6-phosphate to glucose. That's what it does. Got it?
Okay.
Versus Corey's disease. In Corey's disease, they say it's the debranching enzyme. So my question is, in Corey's, do I have problems converting glucose-6-phosphate into glucose in Corey's? Yes or no?
No.
No. But I have trouble with the debranching enzyme. So what that means is that, am I able to convert some glucose or some glycogen into glucose? Some glycogen into glucose. Can I convert some glucose-6-phosphate into glucose? Can I do that? Yes or no? In Corey's.
In Corey. Yes.
Some, right? Not too much, but some.
A little, yeah.
Which is why they don't suffer a severe hypoglycemia.
See me.
You see that?
Yeah.
But in von Gerks, they can't convert any glucose-6-phosphate into glucose, causing a severe hypoglycemia. They might even mention lactic acidosis, failure to thrive, all messed up, All right. Now, Pompe's disease. They're going to mention a baby, 6 months, 7 months, cardiomyopathy, cardiomegaly.
Yeah.
You say, what is going on? Crazy. The heart of a 50-year-old man with a bad diet? Nah, that's crazy. Pompe. Yeah.
Pompe.
All right. So then with Pompe's, what are you thinking of? They say alpha 1,4 glucosidase. Basically, that is going to break down the alpha 1,4 bonds in glycogen. That's what it does.
Okay.
Yeah, cardiomegaly.
Yeah.
That's all it does. That's what it does. Okay. I don't know why they say exercise intolerance, because again, normally it's a child, an infant.
Yeah. They will die. Yeah. Yeah. Sure.
Okay. Very nice. Did they? Oh yes, we didn't mention McCardle's. McCardle's is very similar to Pompe's in that the enzyme that breaks down glycogen, that begins the breakdown process, is defective. It's just that they call it in regular for just glycogen all throughout. It's called glycogen phosphatase. In the muscle is called myophosphorylase, and in the heart is known as alpha 1,4 glucosidase. But it's all the same thing. Cherry red spots on the macula. Immediately you got to think of Tay-Sachs and Niemann-Pick.
Sure. Niemann-Pick.
Okay, so in Niemann-Pick it says sphingomyelin is accumulating, but what is deficient?
In Tay-Sachs?
In Niemann-Pick.
Niemann-Pick. The
Sphingomyelin is accumulated, so what is deficient?
Yeah. Sphingomyelinase.
Sphingomyelinase, exactly. Very good. Very good. In Tay-Sachs, they say ganglioside is accumulating, meaning what's affected? What's deficient?
The hexosaminidase.
Hexaminidase. Yeah,
hexaminidase. Yeah.
Hexaminidase. Very nice. Very nice. Okay, very good. Remember, Tay-Sachs lacks. Tay-Sachs lacks the hepatosplenomegaly. They do not have that. Okay, very important.
Okay.
All right, great. Gaucher's disease. This is how I want you to remember Gaucher's. Blood and bone. Blood and bone. Blood and bone.
Okay.
Gaucher's. Okay, because they're going to talk about the pancytopenia, bleeding issues, avascular necrosis of the femoral head, bone crises, blood and bone. Okay.
Okay.
And then they might mention the macrophages, how they look.
Yeah.
Funky macrophages.
Like tissue paper or something.
Yep. Okay, fantastic. Achilles tendon xanthomas, right? So familial hypercholesterolemia, decreased LDL. Okay, fine. All that means is it could be any one of the LDLs, hyperlipidemias rather. Okay. All I want you to remember is that xanthoma is the one that normally presents on like the elbow. I think of xanthoma, right? It hit my elbow, right? Thoma.
Okay.
And then xanthelasma is the one in the eye.
Okay.
Yeah. All right, fantastic. Anaphylaxis following a blood transfusion, IgA deficiency. Doc, IgA, what shape does it take? IgA.
What?
What shape? What shape is IgA?
No, but can you say that again? Because
What shape is IgA?
the shape?
Yes.
Pentamer?
No, that's IgM. It's a dimer. Dimer. Very good, everyone. It's a dimer. All right, this dimer is held by something known as a J chain. Let me see if I can draw it out for you here. So let's say here I have my IgA, right, dimer, and it's held together by a J chain. All right, that little thing in the middle, that J chain, see if I can bring it over here. See? That little thing in the middle, that J chain right there, that is, it could be broken down by IgA protease. There are certain bugs that contain IgA protease, like strep pneumo, H. influenza, and Neisseria. They can kill your IgA. So, Doc, IgA, it protects your mucosa. And every time you think of mucosa, I want you to think of the three things. Three things anytime you think of mucosa. GI, GU, respiratory. GI, GU, respiratory. You know that. Okay?
Okay.
Leading to GI, GU, and respiratory infections. Makes sense, right?
Okay.
All right, nice. So then if a patient comes in with anaphylaxis, right, you give them IgA, containing blood, and they have IgA deficiency, they have anaphylaxis, then what should you do? Your patient is having an anaphylactic attack right in front of you as you're giving them blood. What do you do? Anyone? What do, Doc? You leave them there?
Yeah. No.
No, we got.
No.
We got 60 seconds.
You give IgA.
He's having an anaphylactic attack right in front of you, doctora. What do you do? He's gonna die, Doc. What are you gonna do? Oh boy. He's dead. That's it. That's it. Done. All right. McDonald's is hiring. It's terrible, doctor. You give him epinephrine. You give him epinephrine. He's having an anaphylactic attack.
Okay.
Give him epinephrine. Do you not? You give him the epi.
Yeah.
Epi.
Yep.
What if they say, what's the first thing to do? First thing to do, you remove.
You do the transfusion.
Stop giving him the blood. Then you give him epi, and then you give him IgA deficient blood, or there's a filter that you can give that can filter out IgA from the blood. Okay. So.
Okay.
All right, great. Bruton's disease. So we spoke about that a little earlier. It's X-linked recessive.
Yeah.
Male infection. So B for Bruton's, B for boys, B for bacterial infection.
Bacterial.
Okay. And these are normally children. Around what age do they normally start to get infections in Bruton's? What age?
After 6 months.
Why? Why after 6 months?
Because after that time, the immunoglobulins from the mother will start to decline.
Yeah, that's right.
Yeah.
Mama's protection is gone.
Yeah.
And they can't create their own. So remember that they have no B cells. They lack lymphoid tissue, tonsils, adenoids will be gone.
Yeah.
and they have many bacterial infections. The hint for bacterial infections would be sinusitis, otitis media, upper respiratory infections, all combined should make you think bacterial infection. Okay, very important.
Okay.
Also, I've noticed because IgA, right, is an immunoglobulin, they tend to get GI diseases, specifically Giardia. That's like the one guy that likes to attack anybody who has IgA deficiency. Giardia just loves it, can't get enough. So make sure you know your Giardia. So your patient comes in with a little Giardia and little sinusitis, little strep infection. Okay, you say, okay, this might be Bruton's, right?
Okay.
Because if it was a T cell disorder, what else would they present with other than bacterial infections? If it was a T cell disorder, what would they present with?
Fungal or virus infection.
And or viral infections. And who's the number one fungus that likes to present?
Who is the what?
Fungus.
Who is the last what?
One fungus.
Albican.
Yes, Candida.
Albican.
Nice.
Yeah.
Yes. So your patient comes in with Candida infections, with thrush infections. Canada. I had somebody call it Canada. That's funny. That's why I never thought of it. That's really funny for us. All right. So yeah, Candida infections, right? They have thrush and or just, the vaginal Candida infections, and they have sinusitis and otitis media. So all of that combined, that should make you think of a T and B cell disorder, okay? Maybe like skid. All right, recurrent cold abscesses, eczema, high serum IgE, and eosinophils. Clearly, it's Job's syndrome. So, Doctora, you read the Bible?
Yeah.
Read the Bible?
Hello?
Did you read the Bible?
Yeah.
What happened with Job? Why is he so famous? What did he do?
No, I don't know.
Any ideas? Ooh,
No.
Bad Christian. Bad Christian.
No.
What did Job do? Any idea? He disobeyed God. Disobeyed God, and God lo regañó. That's all it was. That's all it was. He just, he punished him. God punished him. How he made him have these nasty abscesses all over the body. They call them cold abscesses. Remember, staph. It's non-inflamed. That's why it's cold. Staph aureus is the guy who tends to attack. Okay, normally Staph aureus.
Okay.
That Job syndrome. Hyper IgE. They may mention retained primary teeth, or like 2 rows of teeth.
Yeah, hypernumerarities. Yeah.
Yeah, like I think of like shark teeth. They got like
Yeah.
May or may not mention a redheaded female, and I'm talking about pure redhead, not the ginger that's orange.
No.
Red, like blood red, no de farmacia, not like one of our cousins, nothing like that. I'm talking about pure. Okay. All right, maybe or may not mention that, maybe not. All right, but what about the strawberry tongue, also known as a beefy red tongue? Strawberry tongue, beefy red tongue. Gotta remember that. High yield, crazy high yield. Okay,
Yeah.
Scarlet fever and Kawasaki. So now we're talking about scarlet fever and Kawasaki. What gives away scarlet fever? What's a buzzword for scarlet fever?
Descamarin. The descamarin rash, or same
Right.
paper.
Sandpaper rash. You got
Yeah,
it.
same paper rash. Yeah.
Very nice. Desquamating rash. Sandpaper like rash on palms and soles. What about Kawasaki?
Yeah. Yeah.
What about Kawasaki's disease?
Descamarin skin of the hands and soles are affected.
Yep.
Also fever for more than 5 days in his child.
How high is the fever?
High.
How high is high?
Like more than like 100.
Like 104.
104. Okay.
Yeah, it's very, very high. Very, very high fever. for about 5 days, 3 to 5 days. Okay.
Yeah.
They're going to mention conjunctival injections, which is just red eyes. Conjunctival
Red eyes.
red
Yeah.
eyes. Who has conjunctival injections? Kawasaki's.
That was.
Right. Adenovirus can cause that.
Adenovirus.
Right. Public pool, they put chlorine, but there's people that do weird things, you pee and stuff, nasty. All these chemicals. You can get a little adenovirus in the eye. And they'll say marijuana use also. All three of those. Those are 3 high yield ones that can lead to conjunctival injections. Nice.
Okay.
Those are, yep. Nice. Good job, everyone. Everybody got them. Okay. Let me see. What else? Oh, so since we are talking about palms and soles rash, Doc, do you remember the mnemonic? Anybody have a mnemonic for palms and soles rash? That shit causes
Rocky Mountain spot fever.
Rocky Mountain spotted fever.
Secondary syphilis.
Ooh, that's one. That's another one.
And Kawasaki's. Yeah.
Remember the mnemonic is tricks with 4 S's. Tricks with 4 S's. TRICKSSS. Tricks with 4 S's.
Tricks.
Write that down. So the T for toxic shock syndrome.
Okay.
Toxic shock syndrome. The R, as you said, Rocky Mountain spotted fever. The I is just there to make sense. I need a vowel. If not, it's just a bunch of consonants. It doesn't make any sense. The C is for Coxsackie A virus, hand, foot, and mouth. K is for Kawasaki's. The first S is for syphilis. The second S is for staph scalded skin syndrome. A lot of S's in that one. The next one is syphilis. Oh, I said syphilis, I'm sorry. Scarlet fever.
Okay.
And Stevens-Johnson syndrome. Stevens-Johnson syndrome. Okay. So they say rash on the palms and soles in a girl who left her tampon and then a little too long. Okay.
Yeah.
Shock. Or if it was a guy who maybe put a tampon in his nose and left it in there for
Nice.
right? Or they say nasal packaging. Okay. Same thing. It'll be due to do you know the name of the toxin and what bug? What bug and toxin is it?
It's Staph aureus.
Staph aureus causing?
The toxic shock.
Okay. And what's the toxin?
Toxin alpha or something alpha.
So it's called TSST. Toxic shock syndrome toxin. TSST.
Okay.
Can you explain to me the pathophysiology behind the TSST toxin?
I think it has to do with the T cell and CD4.
T cells.
T cells, yeah.
Yep. But what are T cells? I thought you said T cells. They protect us from viral and fungi. This is staph. Staph is a bacteria.
Yeah.
So how is that possible? What's so unique about this TSST toxin? It's also known as what's another name for this toxin?
No, I don't remember.
A super duper holy shit ultra mega on another level. They call it super antigen, but that's how I understand it. Super duper holy crap ultra mega on another level. What does that mean? Bacteria normally are attacked by B cells and neutrophils. But this antigen is so super duper holy shit ultra mega on another level that neutrophils and B cells can't do anything about it. So you got to recruit T cells, and then T cells cause the disease. So all right, nice. Yeah, that's how I remember that one. It's a lot of stuff to remember. So I'm just gonna again remember the exam. It's not about. It doesn't matter how you remember it. Just remember it, right?
Yeah.
All right. So that was toxic shock. What about Rocky Mountain spotted fever? What like how do you get that? What is this? What's so unique about
That's this. Yeah. You got this disease by the rickettsia. Yeah.
Can you talk? What about the in regards to the rash? What's so unique about the rash and or its distribution?
Eyes only on the.
I'll give you a hint. You started bad when you said only.
Yeah.
I want you to know the distribution.
Yeah, distribution.
Rash. It's very specific, the distribution of this rash. Why? How does it distribute, Doc? It distributes on the hands first,
And then
it goes inward to
inward.
the body. Please know that. Hands first, and then it moves inwards. What are some other unique rashes that have a unique presentation? Well, what about measles? Presents on the head, then it comes down,
Yeah, down.
and then it disappears from the head and down. See?
Okay.
Other than that, it'll just be either generalized or for the most part, it'll be like on the trunk. Let's say trunkal.
Yeah. Okay.
Nice. Okay, so that was where were we? That was Rocky Mountain spotted fever. Coxsackie A, hand, foot, and mouth. It's literally just, well, hands, feet, and mouth. So pretty straightforward on that one. What else can we say in regards to, we said Kawasaki, we spoke about Kawasaki's.
Yeah.
Staph scalded skin syndrome. What do they look like? Staph scalded skin syndrome. What's the presentation? How would they explain or describe, rather? How would they describe the rash in staph scalded skin syndrome?
Like sunburn.
Exactly. Like sunburn. Sorry, I had to put the laptop charge. Yeah, like a sunburn appearance. Yeah, literally. And they call it a Nikolsky sign. Nikolsky sign positive, meaning it just like comes right off. You know, you've been in the beach too long, and you just want to get a little brown.
Okay.
You put on instead of putting sunscreen, you put on that aceite, that burn, right?
Yeah.
You get me bronze, looking nice, and then you start peeling. Same, very similar, but significantly worse. Okay, so yeah, Nikolsky sign. Very good, very good. Okay, let me see here. Anything else? So that was staph scalded skin syndrome. Syphilis. How do you get syphilis?
For unprotected sexual intercourse.
What bug normally is?
Treponema pallidum.
Treponema pallidum. Very nice. What type of condylomata is associated with syphilis? Is it alata or is it acuminata?
Lata.
That's alata condylomata. Very nice. That's syphilis. Right? That's what happens. Be careful, guys. So yeah, condylomata lata. Very nice. Painless or painful sore?
Painless.
Painless. Very nice. Very nice. Then eventually, so he attacks the penis. He goes through the penis, and he goes right to the back. Boom, to your what's this called? The dorsal column, right? Now
yeah, the posterior. Yeah.
Right, leading to tabes dorsalis.
Yeah.
Climbs up, and then eventually it attacks your aorta, the arc of the aorta.
Yeah.
What vessels does it attack specifically within the aorta?
The ascending aorta.
What vessels within the ascending aorta?
The vasa vasorum.
Excellent. Vasal.
Yeah.
Very good. And what's another name that they'll give for what is this? The damage of, so like syphilitic aortic disease. What's another name for it?
Vasa vasorum.
Itis? What's another name for that? The aortic disease associated with syphilis. ¿Cómo se llama?
Yeah, I know, but I think they also mentioned the vasa vasorum necrosis. I don't know if necrosis.
It's called endarteritis, obliterative endarteritis. Yes. It'll have a tree bark appearance, They'll say wrinkled intima. That's another buzzword. Wrinkled intima, tree bark appearance. Oh, maybe woke up. So they'll say wrinkled intima or tree bark appearance. All right? Remember that, please.
Okay.
Syphilis continues moving up. Yes, it spreads to your hands and your feet. Continues moving up. Boom, makes it to your brain, right to the eyes. And then what happens to the eyeballs? The Argyle Robinson pupil. What is that?
Yeah, it doesn't reflect, but it accommodates.
Nice. The prosecutor's pupil, right? Doesn't react.
The pupil.
Very good.
Yeah.
Very nice, very nice. Okay, excellent. Let's see here. Scarlet fever we spoke about, and then what's the last one? Stevens-Johnson syndrome. What is that? Well, who gets Stevens-Johnson syndrome? Mr. Stevens-Johnson.
Someone on lamotrigine.
So drugs, after drugs.
Drugs, after drugs.
The drug reaction, it could be penicillin also.
Yeah.
Okay, Stevens-Johnson, Dubin Johnson's younger brother. Okay.
Yeah.
Speaking of which, what is Dubin Johnson?
Dubin Johnson is a defect in bilirubin, and you are the liver will appear like dark black color.
That's right, it'll be a black liver.
Yeah, black liver, yeah.
Because of the inability to release conjugated
bilirubin, yeah.
Very nice. Very good, very good.
Yeah.
All right, excellent. Oh, give me a second. Okay. Let's see here. What else do we have? Okay, so next one, we're talking about abdominal pain, diarrhea, leukocytosis. All right, so basically abdominal pain and diarrhea after antibiotic use. Sometimes they'll say clindamycin, sometimes they'll say quinolones, other times it doesn't matter, they'll say broad spectrum antibiotics, okay? Point is, they poo a whole bunch after antibiotics. Bug.
Yeah, Clostridium difficile.
Okay,
yeah.
Next. Now, why does Clostridium difficile cause this disease? Why, when I give a patient antibiotics, does Clostridium cause disease?
Well, because the antibiotic will wash the other bacteria in the GI and Clostridium, yeah.
So I have it understood that we have a lot of gut bacteria and Clostridium. Clostridium is hanging out right now.
One of them, yeah.
He's one of many. But he's like a younger brother who likes to just, just little crazy younger brother. I don't know, a little wild. And you got to keep him in check. Say, hey man, take it easy, calm down. So that's E. coli, Bacillus fragilis, Strep bovis. They all like kind of keep him in check. But once you give these patients broad spectrum antibiotics, for some reason they don't affect Clostridium. Yeah. And therefore, once everybody's gone, then I can proliferate and do whatever I want, making it very difficult, difficult to poo.
Long along.
So
yeah.
Yep. So that's important. Therefore, how would I treat Clostridium difficile?
Yeah, you can try vancomycin.
Vancomycin or?
Yeah, metronidazole.
Metronidazole works well.
Fidazomicin.
Nice. Doc, Clostridium, is this gram-positive or gram-negative?
Gram-negative.
Ooh, swing and a miss.
No.
Clostridium.
Positive.
Exactly, gram-positive.
Yeah.
Gram-positive what?
Gram-positive.
The anaerobe. What else? Gram-positive what? I got people over here also. They're trying. They're answering too.
Yeah.
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 Gram-positive.
Yeah.
Say it.
Rod.
Gram-positive rod.
Yeah.
Doc, what's your mnemonic for your gram-positive rods? Do you have one?
Yeah, I have.
What's a mnemonic? Are you there? What?
Yeah, I'm here.
Do you know the mnemonic?
It doesn't come to my mind right now.
Okay, do you know the gram-positive?
Yeah, but
What are they? VOC, Vibrio is gram-negative. Doctora Aldarondo. Are you a fan of LeBron James?
Yeah,
I heard he.
I two. Yeah, I know it's two with L, and
So LeBron James is corny and claustrophobic. LeBron James is corny
yeah, Castro.
and
Yeah,
claustrophobic. Yes. So L for Listeria.
yeah, Listeria.
LeBron, LB. Listeria, Bacillus. Okay. Clostridium and corny or corny. LeBron James is corny and claustrophobic. All right.
Okay.
So, very good, very good. That was, let me see. That was C. difficile. Okay. All right. Back pain, fever, night sweats, POTS disease. What muscle is what can be affected in POTS disease, causing vertebral TB? What muscle tends to be affected?
The psoas.
All right, for us.
The psoas muscle.
The psoas. Very nice, psoas muscle. Muy bien. Okay, nothing I can really say about that one. Adrenal hemorrhage. So we were talking about this earlier, right? We spoke about Addison's and cons. What we didn't speak about was what if I had. And we also actually spoke about the adrenal diseases, right? 21, 11 hydroxy.
Yeah.
All right. So what if I had adrenal hemorrhage? It's the same thing, right? I'm not going to have any.
Yeah. Anyway.
Yeah. They tend to mention gram-negative cocci, Neisseria. Okay.
Yeah.
Waterhouse-Friderichsen syndrome. They're going to mention petechia, a petechia-like rash. They're going to mention DIC, or not mention it, but they're going to give you reason to believe DIC.
Okay.
What labs? Bleeding time, PT, and PTT. What labs do I see in a patient with DIC? PT, PTT, and bleeding time.
Yeah. Bleeding time increase.
Well,
PC will be low.
bleeding time, PT, and PTT. DIC.
Increase both.
Everything.
Yeah, everything.
Everything is increased in DIC. Everything's increased. PT, PTT, and bleeding time. It's the only disease that presents that way. Okay, please make sure you know that. Okay, good. They give us red currant jelly sputum, alcoholics, diabetics, aspiration pneumonia, right? Klebsiella.
Yeah.
What is currant jelly? What do they mean by currant jelly? What do they mean by currant jelly?
Yeah, like the mucus.
Like mucus.
Mucus.
Yeah, mucus and blood. Very nice. Mucus and blood. That's if they said currant jelly sputum. What if they said currant jelly stool? Now what is that? Currant jelly stool.
Menker diverticulum.
Nope. That's bloody stool. Currant jelly stool. Intussusception.
Yeah.
Yeah, a lot of S now.
Yeah.
Yeah, they'll mention currant jelly stool, right?
Yeah.
All right, very nice. Klebsiella. He's an anaerobe, so how would I treat him? How do I treat the Klebsiella? What
Klebsiella.
Yeah, can I get anaerobes above the diaphragm?
Clindamycin.
Excellent, clindamycin. Hey, doc. Mechanism of action of clindamycin.
Clindamycin Syphilis.
Nope.
No.
Stop
It
down.
inhibits the. Yeah, it inhibits the synthetic protein by the 50S ribosomal CPN.
Yes, I'll take it. 50S inhibitor, I'll take it. Causing decrease in protein synthesis. Very nice.
Yeah.
Good. Patient comes in, large rash, bullseye appearance, erythema migrans by the Izotes tick. That's Lyme disease. Doc, so
Lyme.
What makes me think Lyme disease other than the rash? What else can Lyme disease cause?
The bilaterally paralysis of the face.
All right, so we have Bell's palsy. What else?
Yeah.
What about the heart? Lyme disease.
3rd-degree AV block.
Very nice, 3rd-degree AV block. Killing it. How would I treat?
Doxycycline.
Very nice, doxycycline. Mechanism of action?
30S ribosome.
Very nice, 30S.
Yeah.
Nice. Okay, let's see here. We spoke about the, oh yes. So patient comes in after being treated with penicillin, he has syphilis, and after being treated with penicillin, he has this, the fever, chills, headache, myalgia. That's called that Jarisch Hochheimer.
Yeah.
Like all hail Hitler, right? Kind of like one of those, it's very German Hochheimer, I don't know.
Yeah.
Like, what's wrong? You're ripping up the bug, and he's releasing his toxins into the world. And it's something that commonly happens with treatment of antibiotic therapy. It's not the only time it'll happen. It's common. You have a disease, you get treated for it, and then you actually get a little bit worse before you get better. You have a child, I have two. When they get the vaccines, don't they tend to get like fever and feel a little bit bad that day, a little bit in the evening, and then the next day they get better? Yeah, it happens. It's fine. Right.
Okay.
So that's Jarisch Hochheimer. Right. Dog bite, cat bite. Mostly dog bite though. You're thinking of Pasteurella.
Okay.
Okay, dog bite, cat bite. What if the dog licks your eye? Now what are you thinking of?
In the eye?
If your dog licks your eye, it also comes from the Isotes tick.
The Babesia?
Not Babesia.
No.
The other one, Ehrlichiosis. He licks your eye,
Ah, okay.
Anemia.
Okay.
Ehrlichia.
The
dog licks your eye, you can get ehrlichiosis.
Okay.
So you could be careful when, some of these people, they really love, dog lovers. I get it. I love my dog too. So I understand how you don't mind a dog licking your face, but just be careful. All right. So, okay. What else? Where are we? Rash and palms and soles. We did that. Black eschar on the face of a patient with DKA, mucor and rhizopus species. At what angle do they branch?
45.
Swing and a miss. Try again. Mucor and rhizopus.
90.
90 degrees, because who's 40?
No. Aspergillus.
Exactly. Better remember that.
Yeah.
Mucor and rhizopus is 90-degree angles. Got it right.
9. Yeah.
Remember that. All right. Good. All right. What about chorioretinitis, hydrocephalus, and intracranial calcifications? Chorioretinitis, hydrocephalus, intracranial calcifications. You're thinking of congenital toxoplasmosis. So how do you get congenital toxoplasmosis? How do you get that? What do you got to do?
Yeah, when the mother got infected while she's pregnant.
Yeah, what is mom doing that got her infected with toxo? Pregnant mom.
Well, she might be cleaning the kitty cat. Yeah.
Playing with cat poop. Exactly. Because who likes cats? Honestly, no. I'm kidding.
Me.
I'm a dog guy. All right. So yeah, playing with cat poop. All right, but what if it's a man, right? He's not gonna get pregnant.
Yeah.
He get toxo.
Yeah, maybe he had some contaminated meat, like pork meat.
Contaminated meat. Yep.
Yeah.
And what else? Because it's not just contaminated meat. There has to be something else about him. What else could potentially lead him to getting toxo?
Immunocompromised patient.
Exactly, immunocompromised. A CD4 count of about what? Just under what? Makes
200.
200 is PCP. What about toxo?
Toxo, so 150.
100.
100?
150. You got to remember those three. 200, 150. Less than 200 is PCP.
Okay.
Less than 100 is toxo. Less than 50 is Mycobacterium avium.
Okay.
So MAC.
MAC.
All right. Very good. Very good. Very good. Okay. Very nice. What else do we have? Child with a fever develops a red rash on the face that spreads to the body, so they call it erythema infectiosum. Fifth disease, slap face, parvovirus B19. What other disease does parvo B19 cause? What else is it associated with?
Aplastic anemia in sickle cell.
Yeah, very nice. So an aplastic anemia with sickle cell disease. I like that. Very good. So an anemia. Very good. Very good. Very good. All right, doctora. Fever, cough, coryza, conjunctivitis, Koplik spots. Disease?
Yeah,
What disease is that?
measles.
Measles. We have rubella and rubeola. Which one is American? Which one is German? Rubella, rubeola.
The rubella is American.
Bella, bella, mozzarella, bella. I think like Italy, German, way over there, Europe.
Okay.
All right. And then rubeola, hello, hola. Right? That's what I speak. I'm over here in America. That's what you speak. We're over here in America. So American. Rubeola.
Okay.
Rubella. And I kind of do that with my hands, right?
Okay.
So if I do this with my hands, I remember that rubella, doing this, to do this all day, every time you talk, gotta hurt your fingers. So I remember them to have arthritis. You see?
Okay.
So rubella has arthritis and lymphadenopathy, whereas rubeola does not. Okay, be on the lookout for that.
Okay.
All right, very nice. Let me see here. What else? So we spoke about aortic regurg and the bounding pulses and what it looks like on the graph. Aortic stenosis. We spoke about PDA, the machine-like. Okay, so if a patient has a PDA, right? Why would I want to keep it open? Here it says keep it open with PGE analog, like alprostadil. Why would I want to keep a PDA open?
To to keep a proper oxygenation.
Why? Under what, like what disease? What situation?
Cyanotic diseases.
Such as?
La Fallot.
Not to try.
No.
But before that, like transposition.
Transposition of the great transposition.
Transposition, exactly. Truncoceriosis, total non-rabies return. I say that 5 times fast. All right, very nice. Yes, those are the one of those cyanotic diseases. You want to make sure you keep that PDA.
Yeah.
Under normal circumstances, though, you want to close that with indomethacin. Because how does indomethacin work?
It'll block prostaglandins.
Blocks prostaglandins.
That produce vasoconstriction.
Nice. Very good. All right. Let's see, what else do we have? We continue. Chest pain on exertion. That's okay. So stable versus unstable angina. What's the main difference between stable versus unstable angina?
The duration of the symptomatology.
Sure. Duration of the
Sure. Yeah. And they get better with nitroglycerin.
They get better with nitro. Okay. Sure. What about stenosis? What percent stenosis would be with
I don't know, 70%.
At least 70% for stable angina. Unstable, at least 90% stenosis of whatever blood vessel they mention.
Okay.
All right. Very nice. So here, I want you to notice something, because this was always this always confused many of my students. The STEMI, non-STEMI angina, they're like, I don't understand it. I'll put it to you like this. We just said that angina is 70 or 90% stenosis, but we never said 100% stenosis. We never said 100. It's always less than. Once you reach 100% stenosis, that's called an infarct.
Okay.
So for them to say STEMI, non-STEMI, I'm like, you mean MI? That's an infarct. Complete obstruction, whether you have elevation or not. complete obstruction, meaning cell death, which is why troponins or just cardiac enzymes, that's why they increase.
Okay.
Versus
Yeah.
angina, whether it's stable or unstable, you should not have an increase in cardiac enzymes because it's not an infarct. Okay, please remember that. Be aware of that.
Okay.
Be aware of that. All right, very nice. Dressler syndrome, they say chest pain, pericardial effusion, friction rub, classically happening a few weeks after an MI.
Yeah.
Okay, this is just a unique phenomenon that occurs. But I do want you to understand this, though. It says 2 weeks, so it says fibrinous specifically. Fibrinous pericarditis. Why fibrinous? Because an MI, remember, is inflammatory, right? It's inflammatory.
Yeah.
What cells normally predominate in acute inflammation?
Neutrophils.
Neutrophils, and we have swelling neutrophils.
So
And
yeah.
Sometimes we have T cells and macrophages causing granulomas. That's plus or minus. But definitely neutrophils and definitely swelling. Well, then what about in chronic inflammatory disease?
Yeah, we have fibrosis and
Fibrosis.
fibrosis. Yeah.
Mm-hmm. And scarring, sclerosing, T cells,
The scar.
and
Yeah.
granulomas.
Yeah.
So this is 2 weeks after an MI, 2 weeks to several months, even better. So this is well after an inflammatory disease. I expect to see fibrinous, just a lot of fibrin deposits, scarring, sclerosing, things of that nature. Okay?
Okay.
Makes sense. Okay, nice. That being said, Doc, T cells and macrophages, when do they normally show up? Around what day?
Well, after 1 week.
No. That's too long.
As is 3 days, and then after the third day.
Exactly, about 3 days. About 3 to 4 days roughly. Good. When do they peak? What are they peaking?
Fifth day.
About a week. At about a week.
Okay.
So,
Okay.
About a week or so, right? Maybe 10
Yeah.
days. All right. What does that mean? What do T cells and macrophages do? These granulomas. What are they doing to this dead tissue?
They get rid of the granulation.
They're eating it away. They eat away dead tissue.
Yeah.
They replace the dead tissue.
With the scar.
No. T cells and macrophages. Do they replace it? See or no?
No.
No, they just eat away. Eat.
Yeah.
Who puts it down? Fibroblasts have to come in. When do fibroblasts show up? At what day? When do fibroblasts show up? Around what day?
After 1 week.
After about a week, they show up, and then they peak in about a month. So what that means, Doc, at about 7 days after an MI, you have a lot of T cells and macrophages and granulomas that are eating away all this dead tissue, not putting it back into place. And then you have fibroblasts who are just showing up. It's going to take a while for them to peak. So I have all this all these T cells and macrophages who are eating away this tissue. Now I have a very weak wall, and then that can lead to ventricular wall rupture. Okay? Nice. All right. Painful red raised lesions on the finger pads and toes. That's that Ozer node stuff. Oh.
Yes.
Live video ended. Oh. Okay.
I think when it's too long, they they shut it down.
Oh man. Okay, that's fine. Share to IG. Nice. That was cool. Okay. Bueno. Either way, I wanted to end at 1, but let's end right here. We're gonna end here with the painful lesions and Ozer nodes.
Okay.
Okay. So this is infective endocarditis. Yeah. Meaning, who causes endocarditis? What bug?
Staph aureus.
Staph aureus does not cause this. Well, it could. It could.
Uh,
Not the one necessarily associated with.
ah,
Oh, okay.
okay.
That's good. No, you're right. You're right. It could be.
Yeah.
No, definitely could be. Definitely could be staph. That'll cause acute endocarditis.
Yeah, acute.
Acute,
Yeah.
versus what is this one? Strep viridans,
Yeah.
mitis, and mutans or sanguinis.
Bitterness. Yeah.
One of those. Okay. Nice. Great. So we have what else? Who gets staph? Who gets this staph? Mission?
IV drug abusers.
IV drug abusers. Okay. How do I get viridans?
A previous valve, a previous damaged valve.
Previous damaged mitral valve, or and then what would you have to be doing to get it? Right. Is that
yeah, you have to dental procedure.
exactly. Right. So I remember like this: strep viridans, V for viridans. No, I'm sorry. Well, strep viridans can become mitis and mutans, M&M, and if you eat a lot of M&Ms, you're gonna have to go. You're gonna get caries, and you have to go to the doctor, the dentist.
Yeah.
Okay. All right.
Yeah.
Let me stop recording.